Greetings and welcome to Ask the Doc. Now, each week I talk with medical officers, doctors and nurses who are working with NeuroX, a comprehensive psychological and neurological care portal that is both web and app based. Today, I'm lucky enough to be joined by Abigail McKay and Dr. Mohammed Farooq, both of whom are with telephysicians, American telephysicians. And we will be discussing strokes because today, or in fact, all through May, it's National Awareness of Stroke Month. So this is something that is so important for so many people to find out what it is that they should be looking for. And the very first question I have, welcome Dr. Farooq and Abigail, and the very first question I have is, what is a stroke?
Oh, thank you so much, Adrienne. It's so nice to see you again. And hi, Abigail. I hope you're doing well. Yeah, this is really important month from stroke standpoint because stroke is the 5th leading cause of death in the US, and stroke can happen at any age. And the most important point is 80% of the strokes are preventable. So basically, stroke is the lack of oxygen and nutrients to the brain, and it can happen in two ways, either due to blockage in the blood vessel or due to the rupture. If it's due to blockage of the blood vessel, we call ischemic stroke, and if it's due to rupture of the blood vessel, we call it hemorrhagic stroke.
Interesting.
Okay. And I know that there's a can you tell us what exactly a TIA is? And I know that a lot of people don't take them seriously, but I know that they are a medical emergency. So could you tell us a little bit more about that?
Yeah, definitely, Abigail. TIA should be taken as a neurological emergency because this is kind of warning sign. Stroke is tricky because there is no pain with stroke. Just like somebody has ischemic heart disease and have heart attack, they have chest pain. In stroke, there is no pain. However, patient can have transient symptoms like transient weakness, difficulty in speech, difficulty with their vision. So if symptoms are lasting for a short time and recover completely and patient has no deficit, mostly it is known as transient ischemic attack or mini stroke, or we also call TIA. If we go strictly by the definition by American Heart and Stroke Association, the new definition is if we see damage on MRI of the brain, that is stroke. If there is no damage on MRI of the brain and patient has symptoms only, then we call it TIA or mini stroke.
So what are some of the signs, Dr. Farooq, of a stroke, and what should loved ones be looking for?
Yeah, very important question, Adrienne, because we need to know the signs and symptoms because if we see somebody having stroke, we can activate and call 911 right away. So it is important to know that stroke mostly lead to sudden onset of symptom like sudden onset of weakness or numbness, difficulty in speech, facial droop, or sudden loss of vision. Sometime in women, we see that symptoms are somewhat vague, like they can have generalized weakness or they can have some memory problem or disorientation. So symptom can be somewhat non-specific, but mostly sudden onset of focal weakness or numbness or trouble with speech are the most common signs and symptoms of stroke.
Okay. And how do members of the community know the signs and symptoms? How can we remember the signs and symptoms so that we can act quickly?
Yeah, this is actually a good question, Abigail. So it's good to remember that acronym we discussed before one time. That is Be Fast. It used to be fast. And later on, we added 2 more words to it, B and E. Because there are 2 circulations in the brain. So in the front, which is like carotid arteries, and also in the back, the vertebral arteries. Sometimes when there is lack of blood supply or stroke in the posterior circulation, for example, like cerebellum, symptom can be very mild and patient can have like trouble with their balance, or the patient can have sometime only difficulty with their vision. And if we do a typical fast, which is like face, somebody has facial weakness or arm weakness, we ask patient to lift their arms up, and sometimes we see a like a drift, one arm is going down. That we can pick up if somebody is having stroke or stroke-like symptoms or trouble with their speech. Um, so that will indicate the patient is having a stroke or stroke-like symptoms, what we call. So fast is the last one. Is when we see these, somebody is having these like symptom, this is the time to call 911. So as I mentioned, that sometime patient can have only balance problem, or they can have only vision problem. So now we use this acronym B fast. So B is for balance and E is for eyes. In eyes, there can be a couple of things like sudden loss of vision in one eye, or patient has double vision. Um, so all these symptoms can indicate stroke or stroke-like symptom, what we call, and the patient or the person who is watching that the person is having a stroke or stroke-like symptom, they call 911 right away.
And it's really not a case of wait until you see all the symptoms. If you see any of those, then immediately call 911, because the faster you get the patient to the hospital, the better it is for them, isn't it?
Absolutely, Adrienne. So I'm glad you mentioned that. So any of these symptoms can be, because that depend upon the area of the brain where the stroke is happening. So even one of these symptoms, we should call 911 right away, because if somebody is having a stroke, we can lose almost like a 2 million neurons in 1 minute. So time is everything. Therefore, we call time is brain. So we cannot lose even a single second. So in stroke care, we are very picky actually. So when we see this patient in the emergency department, we really care about time, and every single second counts.
Yeah, absolutely. So you say once you get somebody into the hospital, there are several different types of strokes. How are they diagnosed?
Yeah, very good question, Adrienne. So when the patient come to ER directly, mostly from the ambulance, it goes to the CT scanner. So CAT scan mostly in most of the hospital, that is the first test which we do, because we need to differentiate whether patient is having ischemic stroke or hemorrhagic stroke. So CAT scan is very sensitive. So when we do the CAT scan, that will tell us right away if there's any bleeding in the brain or stroke is due to the blockage in the blood vessel. So along with CAT scan, we also do some very special scans nowadays called CT scan angiogram. So CT scan angiogram basically look at the blood vessel, and if there is any blockage in one of the main blood vessel in the neck or in the brain, we can pick up on the CT scan angiogram. Over the last several years or even longer, we have been using a special scan which is called CT perfusion. So to see if there is any lack of blood supply to the brain, and how much the area of the brain we can save, and how much the area of the brain which is already damaged. So that is called CT perfusion. So most of the stroke center do these scans very quickly within 1 or 2 minutes. So CT scan, CT angiogram of the head and neck, and also CT perfusion. Later on, patient when admitted to the hospital, they can have some more testing like MRI of the brain. If there is a small stroke which we cannot see on the CAT scan, that we can see very easily on the MRI. And when we see this patient in the hospital, we also try to find the mechanism of stroke, why somebody has stroke. So we do some more testing, for example, some special blood test, echo of the heart, and we also monitor their heart rhythm to make sure patient is not having abnormal heart rhythm, what we call atrial fibrillation.
Dr. Farooq, I know that you said time is brain. So I want to know kind of how you treat a stroke so that you can save as much brain as possible.
Yeah, absolutely. So when the patient come to ER, the reason we save even a single second, because if somebody qualifies, we give a medication called TPA, or tissue plasminogen activator, or commonly known as clot buster. So that patient who is having a stroke can get some benefit from this medication. And many times we see patient recover very quickly after the medication. So that medication can be given within the first 4.5 hours from last known bell when the patient was completely normal. So this is time sensitive issue. So that medication we give right away in the emergency department. And if somebody has any blockage in one of the main blood vessels in the neck or in the brain, we have doctors who can go from groin and or from the wrist and take the catheter to the brain and remove that clot mechanically. So that is a new technique, and CT perfusion help and guide us which patient will qualify for this intervention, what we call mechanical thrombectomy, or removing the clot mechanically from the brain, especially if there is any blockage in one of the main blood vessels inside the neck or in the brain.
Thank you. Now, can anybody have a stroke? Are there certain things that you can do to prevent a stroke? And I have another part to that question, which is if you've already had a stroke, are there any things that you can do to prevent a stroke?
Yeah, absolutely. So I think what we need to focus like nationwide is primary prevention. So as you know, prevention is better than cure, right? So if somebody can control their blood pressure, their glucose, their cholesterol, and if they have any other risk factors, for example, if they have sleep apnea, if that is managed properly, we can prevent. As I mentioned before, almost 80% of the strokes we can prevent if we aggressively control the vascular risk factors. So we need to create awareness in our communities, especially during this National Stroke Awareness Month, that most of the stroke we can prevent, and we need to aggressively control the vascular risk factors, especially the blood pressure and high cholesterol and diabetes. And if somebody has some other habits, just like smoking, they should try to quit. And the same thing like for secondary stroke prevention, Adrienne, you mentioned if somebody has already a stroke and how we can prevent any more strokes. So what we call secondary stroke prevention, to prevent second stroke or third stroke. So for that is the same thing. In addition to that, beside controlling the vascular risk factors, we do some special testing and workup and see somebody is having like abnormal heart rhythm. We start some stronger blood thinner, and that helps to prevent that. And also, if somebody has any blockage in the blood vessels in the neck, we can treat that. Vascular surgeons can remove the plaque from the carotid arteries, and similar other things can be done. Like, for example, starting a patient on some blood thinners like antiplatelet medication like aspirin, or stronger blood thinner, just like warfarin. And now we have some newer medications such as rivaroxaban and apixaban. So all these things will help in secondary stroke prevention.
Well, Dr. Farooq, Abigail, thank you so much for talking about this, especially May, as you said, it's National Awareness Month for strokes. And once more, let's say, be fast. Thank you very much.
Be fast, absolutely. Thank you, Adrienne. Thank you, Abigail.